Welcome to the Cancer Treatment Center at Hazleton Radiation Therapy Series, folks. Here at the Cancer Treatment Center at Hazleton, 30 years with unbelievable staff. Have helped many cancer patients in our community. We also have, through the Hazleton facility, patients can have access to the most advanced treatment options available to them, including conventional radiation, et cetera, et cetera. But we're talking about Cyberknife radiosurgery, okay, and all of the different things that are involved with that. My guest today, as I promised you in the last show, Dr. John Lamond, who is the medical director at the Philadelphia Cyberknife, and we're going to get a little bit more specific. We're going to continue on our conversation
Sure,
we did last
absolutely.
month. Okay. So now, when we're talking about the stages of cancer, I think we asked you that before. Okay.
Right.
So there's stage 1, 2, 3, and 4. Okay, and what we've heard for the layperson when they hear, oh, he has stage 4 cancer, that's it, he or she, they're done, etc. Is that true?
Well, it used to be true, but these days things are changing and changing rather rapidly. So, for instance, when President Carter was diagnosed with stage 4 melanoma just a few years ago, if he was diagnosed 20 years ago, yes, he wouldn't be alive and well, not only alive and well, but cancer-free at this point, given he got radiosurgery to the brain and he was treated with immunotherapy and now he's cancer-free. So this is one of those exciting advances that we've seen with melanoma. Not everyone, but we're seeing patients that are long-term cured of their stage 4 melanoma. And we're looking forward to similar results from stage 4 lung cancer. We're not quite there yet, but we've seen some great advances with immunotherapies and targeted therapies and with doing radiosurgery for certain select patients.
Now, before we get into the Cyberknife and all the great things, how do people, I know this is a dumb question, but they call it preventative medicine,
Right.
It's to do this so you don't get this, okay?
Right.
Are there ways that people can get tested or know if they have a cancer before it gets to a degree of second, third, and all of a sudden, oh my God, you have 4th stage, and
Right.
Are there ways that people could do that?
Well, we're starting to continue to improve on our screening.
Okay.
Many people know there's certain screening. At a certain age, you can start colonoscopies at the age of 50, pap smears for women, mammograms for women. So there are screening studies out there. For lung cancer, it's always been a challenge to try to pick up an early lung cancer, but now we're starting to screen patients that are at high risk. Generally, they've smoked for a long period of time. And so usually, if they're a certain age, and if they've smoked what we call pack years, at least 40 pack years, then they potentially could get screened to see whether or not they have lung cancer, and they may need to, on occasion get
what is
these
that
CT
screening
scans.
like?
So it's a fancy scan, a CAT scan that's done.
Yeah.
And so we're trying to pick up lung cancer earlier.
Yeah.
It'd be wonderful for nobody to smoke. That would be the easiest thing.
Yeah.
But that's not going to happen anytime soon. So in the meantime, we're trying to pick up cancers earlier. And then those patients can either have surgery, or for the patients that either refuse or can't go through surgery because their lungs are so bad, then we have a great option with the Cyberknife, and we have a very high chance of curing them in that situation.
How do we convince the people out there who've been smokers for all their years, okay, not to fear, because I know I'm one of them, not to fear, what if they find something? Well, the point is, find it now, don't you think?
Yeah. I think that's the thing to convince them, that it's much smarter to pick something up before you have symptoms, because with lung cancer, by the time you have symptoms, then you usually have stage 3 or 4 lung cancer at that point. That's much more difficult to cure than stage 1 cancer.
Yeah. All right, so now we get to the person who has stage 3 and stage 4, and we talked about the Cyberknife. In the last show, I said when the first time I heard, folks, a Cyberknife, I'm thinking a big knife coming down, cutting me all up, okay? So let's talk about the Cyberknife treatment and what it is.
It's a type of radiation. It's very focused radiation. And so we're pointing the radiation, usually very thin beams from many different directions, aimed at the same target. So what I use, and patients seem to understand this, is if I was in a room and I held up a balloon and each of them had a little weak pen light, Now that pen light doesn't provide much light, but if there were 100 people in the room and they all aimed that pen light at the balloon and we turned the light off, that balloon would be very bright and the rest of the room would stay dark. And it's where all those relatively weak beams intersect that you see the radiation. The same is true with the Cyberknife. Those beams are only intersecting at the cancer, at our target. And that's why that area gets such a high dose, and it helps to minimize the chance of side effects to the other structures that are nearby.
Do you determine, Dr. Lamond, do you determine how much radiation a specific area gets? For example, if you're doing prostate cancer, or if you're doing lung cancer, what are the areas that you treat?
We can go from the head. We treat cancers that, like for the lung, that go up to the brain. There are cancers or benign growths that start in the brain that we use Cyberknife. For lung tumors, we had already talked about that the cancers that start in the lung or spread to the lung that we can treat. There are cancers that start in the liver or spread to the liver that we can kill off. Cancers of the pancreas, cancers of the prostate, cancers that go to the bone. And many times, if a patient has been treated before with external radiation, we used to say, well, you can't get any more radiation therapy, but now with the Cyberknife, many times we can retreat patients.
That's the fascinating spot. My wife and I, we listen to doctors like you, and we say only if my mother-in-law had that. She died 2006. If they had this advanced therapy available, she would be probably still living today. You don't know, but the odds would be that she would be still living today.
Our cure rates have gone up about 1% per year for the past 25 years.
Is that right?
So there's a lot more survivors out there than ever. We want to continue in that, but right now the majority of people diagnosed with cancer are cured.
So you know specifically what type of radiation to get with a Cyberknife, okay? Are there any after effects that people get?
Well, very commonly, no. I mean, it's not, you can't say that for sure. It depends on the scenario. But the majority of the time, the treatments are very well tolerated, and there's usually very minimal, if any, side effects. But it depends on where we're aiming at. There are some times when it's a little more difficult. When we're treating prostate cancer patients, for instance, they may have mild side effects from urination. They may have a little burning with urination. That's the most common complaint.
All right, so now you have chemo, okay, that people get.
Yep.
So how do we know whether, when the doctor says we're going to give you chemo, or we're going to give you, how do we know when we're getting chemo, radiation, Cyberknife, or, I'm confused.
Well, it is a very confusing thing. There are national guidelines that we have for each stage of cancer telling us what the recommended treatment is. So these guidelines are available in Hazleton as well as New York City. So those guidelines can be very helpful to us to give us an idea. And they're based on studies or trials that have been done with patients in the past. So we have a very good idea many times what the recommended treatment is.
All right, so a person gets treatment and the cancer returns. So what happens if lung cancer returns?
Well, it depends on the scenario. There are some times when it only returns in 1 or 2 spots, and Cyberknife may be a very effective option in that case. And our goal is to kill off those 2 spots with the treatment. The patients may also be on some systemic medication in case to try to limit the chance of other spots popping up in the body. If lung cancer spreads to the brain, then many times we're using Cyberknife. We don't want to treat the whole brain unless we really have to, because the side effects can be greater. So we'd much prefer, if there are 2 or 3 or 4 spots in the brain, just treating those spots alone with the Cyberknife, the chances of severe side effects are much less.
I know, Doctor, you don't have that magic wand. We all wish we had that magic wand to let you know that you're going to be perfectly,
absolutely.
However, when you're looking at odds and you're looking at the fact that people are in trauma when they hear the word they got cancer, it's devastating, okay? And I said, that's the bad news. The good news is, thank God, we have, the Cancer Treatment Center at Hazleton. We have Cyberknife. We have Dr. Lamond. We have great doctors, okay, you've been living this. And you just said in 22 years you've seen all of this stuff.
Things continue to improve. Guidelines continue to change. The Cyberknife wasn't around 22 years ago.
Yeah.
So all these things have changed. Before, we only had one way to do radiosurgery, and it was to put something and screw it against the skull.
Yeah.
Many places still do that
Yeah.
with their gamma knives.
Yeah.
So the fact that we have a Cyberknife, it's non-invasive, it's painless. People that come to us from Hazleton area, they drive down, they get their treatment. They may have to stay a few days if they're getting more than one treatment, and then they drive home. Yeah. And it's infrequent to see really significant side effects. So it's a great advance over what we had 20-some years ago when I started.
Can you share with our audience one of the worst case scenarios that you have seen so far?
He had a tumor in his brain that was removed, and within a few weeks it had grown back even bigger than it was originally. So it was removed again. And we knew at that point we needed to do some radiation therapy afterwards, because this was a very aggressive sort of cancer. It's called a sarcoma that was in the brain. And so while we started the radiation therapy to this area, the patient was complaining of headache, and I'll be darned if the tumor had not grown back to about a ½ inch in size. And we were dumbstruck. A tumor growing this quickly would have a terrible prognosis. And we thought about adding some additional treatment with the Cyberknife. And that patient is now 11 years out from that Cyberknife treatment and is cancer-free.
If you have this advanced technology, and even though I may not be affiliated with you, okay, why wouldn't I tell my patient there is the Cyberknife that's available? I mean, I know it just bothers me to know that we have so much available to us. Why don't we take advantage of that?
Well, I think there's a number of different answers to that, from maybe a lack of familiarity with the Cyberknife. Over time, I think people have become more familiar. Back 12 years ago, hardly anybody knew about it. More people do know about it now. Now, it's not for every sort of cancer,
yes.
so I would say there are many patients where I see them, and I say I would recommend something different. You know, our idea is that we want to point the patient in the right direction. But there are many times when people have different ideas of what the best treatment can be for somebody. But we found the Cyberknife to be very helpful, and we've treated over 3,000 patients, and so we're one of the, in the United States, one of the most experienced places in the country to go to. And
it's good to know. It's good to know. And here we are right in Hazleton at the Cancer Treatment Center, Hazleton, folks. The phone number is on the screen. We have Philadelphia Cyberknife. We have that number on the screen, and we have his website on the screen. Get educated, folks. Just get educated. This is what these shows are all about, just to inform you what's available. Anything in closing you'd like to say?
Well, I think we have a great team at Hazleton with Dr. Karp and Dr. Rigo, who's down here most of the time, goes up. So we have a close working relationship with Hazleton, and for those patients that we think that are up there who need to come down, I think Dr. Karp or Dr. Rigo will send them our way.
They have passion, and I compliment you and all the doctors on having the passion that you have for your patients, and that's
thank you, Sam.
That's
Appreciate
something.
it.
That's the truth. Okay, phone numbers up on the screen, folks. Hope you never need them, but if you do, they're there for you. We'll see you next time.